Megan. My name is Lee Parody and I'm going to be your nurse practitioner today.
Great.
It's nice to meet you.
Nice to meet you.
I just want everyone to know that Megan will not be in a gown today, and if this was a real physical exam, either the patient would already be in a gown or I would step out and let the patient change into a gown, and then I would perform the physical exam. Okay, Megan, what brings you in today?
I'm just here for my annual physical checkup, and I just need my blood pressure medication prescription refilled.
Okay, great. How long have you had, how long have you been on blood pressure medication?
About 10 years.
Okay, and it's for hypertension?
Yes.
Okay. Does anybody else in your family have hypertension? Around
Yeah.
your family?
Yeah, my dad has high blood pressure.
Okay. And your brothers and sisters, do they have hypertension as
No.
well?
Mm-mm.
No. What about any other illnesses such as cancer or stroke, anything like that run in your family?
No.
No? Okay. And then do you have any other concerns today for your physical exam? Are you feeling ill at all, or have you had any headaches, upset stomach, cold symptoms, anything like that?
No.
No? Okay. Are you generally feeling well?
Yep, feeling good.
Okay, good. I'm going to go ahead and start your physical exam now.
Okay.
I'm going to go head to toe, and you just stop me if you have any questions or concerns while I'm assessing that area, and we can talk about it.
Okay.
Okay? First, I'm just going to take a look at you. You have, just look at your general appearance. Your eyes are symmetrical. You have generally good appearance. I don't see any lesions or rashes or moles just by looking at you. I'm going to go ahead and take a look at your scalp. And I'm looking for any lesions, masses, moles, especially some of the sun exposure spots that can be on your scalp. You have good hair distribution and growth. Okay, very good. Now I'm just going to take a look at your eyes. Are you having any trouble seeing?
Nope.
No. Okay, I don't see any drainage, no conjunctiva, redness, swelling, anything like that. And I'm just going to go ahead and take this light. I'm going to take a look at your pupils. I'm just looking for if they're reactive. Okay, very good. Your pupils are reactive to light, and they're equal bilaterally. And now I'm just going to go ahead and take a look at your ears. Are you having any trouble hearing?
No.
No drainage or discharge or pain?
No.
Okay. Now looking for your tympanic membrane. It's pearly and gray. I don't see any redness. Little to no cerumen. Looks good. And just check on the same thing on this ear. Your tympanic membrane looks pearly and gray, no redness. Okay. Now I'm just going to go ahead and look in your ears. I'm checking if your septum is equal bilaterally, no deviation or anything like that, and looking for any drainage or discharge or masses, anything like that. Good, your septum is equal bilaterally, symmetrical. I don't see any masses or redness or drainage or anything like that. Now I'm just going to go ahead and look in your mouth. Can you say ah for me? Very good. Tonsils, no redness, no masses, no lesions of any kind. Your tongue looks good. Any problems chewing, eating, anything like that? No pain?
Nope.
Okay, good. Now I'm just going to go ahead and move to your neck. If you could just move slightly on your side. I'm going to feel your lymphs, and then I'm going to feel your thyroid. I'm just going to start in front of your ears, under your chin, then down your neck for any swollen lymph nodes, and then across your clavicle. Nothing Nothing feels abnormal. Now I'm gonna go ahead and feel for your thyroid gland. I'm just gonna place my fingers around your trachea and have you swallow. Good. It's equal and symmetrical. I don't feel any hard nodes or anything like that. And while we're back here, I'm just gonna go ahead and take a look at your skin. And if Megan did have a gown on, I would take a look at her whole back and make sure there's no any suspicious moles or lesions or rashes or anything like that. I'm just gonna go ahead and listen to your lung sounds. You just take big deep breaths. Okay, very good. You can face towards me. You have good chest rise and fall. I don't hear any crackles, coarseness, anything like that. And I'm just going to listen to your lung sounds on the front of your chest, and then I'm also going to listen for heart tones. Big deep breath. Very good. Now you can breathe normally. I'm just going to listen to your heart. I'm listening for S1 and S2. You have good rate and rhythm. Very good. And while I have you here, I'm just going to feel the lymphs underneath your armpits, okay? Because we do have lymph nodes in there too. Good. Nothing hard or anything like that. Okay, now I'm going to go ahead and check for jugular venous distension. Sitting here right now, I don't see anything abnormal. I'm going to have you lay back at a 45-degree angle and then turn your head to the left, and I'm going to listen for any bruits or anything like that. And if you can go ahead and just hold your breath for me. Okay, good. I don't hear any bruits. And now I'm going to go ahead and listen to your bowel sounds. Are you having any upset stomach, anything like that? Pain? No? Okay. Okay, you have good active bowel sounds. And now I'm going to go ahead and just percuss around your belly button. Noting any dullness or hyperresonance. Now I'm going to go ahead and palpate. I'm going to do a light palpation, moderate palpation, and then deep palpation. You tell me if anything hurts.
Okay.
I'm going to look for any rebound tenderness, any masses, anything like that. Okay. Okay, and then deep palpation. Now I'm going to palpate your liver and your spleen. I'm just going to feel for your rib cage. And if you could inhale for me and then exhale. Very good. And then on the other side. Very good. Okay. Now I'm going to have you sit up. Okay. We're going to do go ahead and we're going to do a little mini neuro exam. I'm just going to have you raise your eyebrows, smile, puff out your cheeks, and then I'm going to have you just follow, just look at me or follow my finger with your eyes, okay?
Okay.
Very good. Now this time I'm going to put my hand in the air and you touch your finger to my finger, okay? Okay, very good. And now I'm going to have you just push up against my hand, shrug your shoulders. Very good. And put your hands out. And don't let me push them down. And don't let me push them up. Okay, and can you squeeze my hands? Good, they're nice and equal bilaterally. bilaterally. You can put them down now. I'm just gonna feel for your pulses and make sure there's good rate and rhythm in there. Okay, and while we're here, I'm just gonna do some deep tendon reflexes. And if I did have a hammer, I would use that on her reflexes, but I don't today, so I'm just gonna go ahead and use my finger. Feel this one. Okay, very good. And now can you raise your right leg straight out for me? And then don't let me push it down. Okay, and then your left leg. Very good. And I'm just gonna go ahead and feel for any edema. I'm gonna feel your pulses in your feet. And then if I did have Megan take off her shoes, I would take off her shoes and then look at her skin on her feet, look at the nail growth, and look at the bottoms of her feet for any lesions, moles, warts, anything like that. Okay, good pulses, good pulses. Okay, can you push against my hands and then push down? Good job. And then can you stand up for me? And I'm gonna look for scoliosis. So if you could face this way and bend over toward your toes. Okay, good. I don't feel any curvature. You can stand back up. And then if you could walk heel to toe to the sink and then back. I'm just checking for your gait. You have good gait, good posture. Perfect, you can sit back down now. Okay, Megan, any questions about that part of the exam?
Nope.
Okay. All right, now I'm just gonna go ahead and ask you a couple of questions.
Okay.
So have you tried any diet or exercise for your blood pressure?
Yeah, so I actually just recently trained and ran a 5K, and I noticed that helped my blood pressure.
Oh, okay, great. Have you heard of the DASH diet before?
I have not.
Okay, it's a low sodium diet.
Okay.
It's known to help hypertension, so I can print you out some sheets on that, and I
That'd be
can
great.
also refer you to a nutritionist if
Okay.
you decide to do that as well. And then regular exercise is always good for lowering your blood pressure.
Sure.
And then just make sure that you're checking your blood pressure regularly, especially before taking your blood pressure medication, because you don't want the blood pressure medication to drop your blood pressure too low.
Okay.
Okay, and then just a couple of some other questions. Do you feel safe at home?
Yes.
Yes, okay. Do you have any feelings of depression or anxiety?
No.
No? Okay. Generally feel safe?
Mm-hmm.
Okay, perfect. Do you have any questions for me?
I don't think so.
Okay, we will get your prescription refilled, and I will print out those sheets for you and give you the card to the nutritionist.
Okay. Thank
Okay.
you.